Well, joining me via Skype from Abuja is a public health and health promotion specialist, Dr. Obinna Ebirim. Good morning. Thank you for joining us on TVC Breakfast. All right, let's begin from home. As it is said, the charity begins from home. We have, according to the NCDC spokesperson, 25,000 kits and 600 tests so far has been done. And you know the number of the population we have in Nigeria, 200 million. Is this enough? If we say we are trying to contain the spread and also ensure that we do not record as much death as other countries.
So thank you. This is grossly inadequate, and I'll tell you why. So we have 134 cases. We are following up over 6,000 contacts. Now, testing only 600, just 10% of those contacts, it's not adequate. Now, talking about a population of 200 million, testing just 600 and having 25 kits, out of which 20,000 were donations, it's grossly inadequate. And as I've said before, we need to ramp up our testing to know the actual number of infected cases in Nigeria. With the number of testing we've done so far, I am not confident that we just have only 134 cases, although those are the ones that are confirmed, but we need to test more to ensure that we know the actual number. And thanks be to God, we do not have, the virus is not as fatal as it is in other countries. And also the efforts of our doctors, nurses, and NDCs thus far, or else we would have been saying a different story altogether at this point.
Now that there is a lockdown in some major cities like Lagos, Abuja, and even Ogun, and even some other states, how would this testing be possible?
So it's first of all, it's not about the lockdown. I must commend the president for addressing the country and putting the lockdown. And I think there are a few more things that needs to be done beyond lockdown. So the government needs to procure more kits. We don't need to wait for donations that we need to validate. We need to procure more kits. We need to approve those additional centers and make sure that people have access to be tested. Then we need to also correct our protocol. So it's not about you call, you are self-isolate, and when you call, people need to go through a case definition questionnaire that if you're now scored to be highly probable to have this virus, then quickly you're tested. But I think that some of those things cannot be actualized now if you have only 5,000 validated kits and you're waiting to validate the 20,000 you're being donated. So government needs to procure more kits and approve those additional centers so people will have access to testing. And I think when we have access, that's when you then see a lot of good news coming from people who call and they pass through that questionnaire, and quickly the officials come to your house and get you tested, and we begin to know the real numbers. It is very critical, because if we do not know the real numbers, then we'll get to know it in 14 days time if this virus is as fatal as it is in other countries in Nigeria. And I think, as I said earlier, we need to thank God. I don't think it's as fatal, because if it's as fatal as it is in other countries, we would have seen more deaths as at today.
Now, you said that the government should look at approving more centers, but do we have the medical personnel that can be in these centers to handle these cases?
So yes, we have a lot of doctors that are trained in Nigeria, and all it requires is some additional training on, and we have laboratory scientists. We have the best. So I'm not worried about the capacity of Nigerians to deal with this. We have the capacity in country. What is required is, do you have the right tools? Are they well trained? And I believe once they are well trained and you provide the tools, they will be able to work. We have teaching hospitals spread all over the country. We have qualified lab scientists there. We have qualified medical practitioners there. All that is required at this moment is the right tools and that extra training to be able to carry out this test. And I think that is about beyond testing. Another important gap we have today, it's awareness at the local communities. A lot of people at the local communities do not know why we have these restrictions. Some of them think it's maybe a one military order, but we need to tell people in the local language. We need to sensitize traditional rulers, religious rulers, use town criers, so people in the local communities will know how to prevent diseases and why we need to, at this moment, stay at home and prevent further spread of it. And also another important thing is people who are essential on essential duties are moving around. We need to begin to wear our face masks. I know it's not recommended for those who are healthy, but we do not know everybody who is not without the virus. So I think that in addition to the restrictions, we need to tell people who are moving around wear a nose mask so that if you have this virus and you're unaware of it, when you cough, it can protect the droplets from spreading around. I think we need to go further to make sure that we contain this spread.
I want to quickly go back to the issue of making purchases. We see some persons and even organizations across the country making donations to the government with regards to the pandemic. From what you have said now, what are your expectations of the government with regards to spending this monies to acquire what is necessary for tackling this pandemic in the country?
Yes, so first of all, I commend Nigerians who have donated. But as a government, you need to take responsibility. Your primary duty is the security and welfare of your people. We shouldn't be hearing at this point that we have only 5,000 testing kits in a country of 200 million.
25,000, you mean?
20 was donation. That's what I just heard.
Okay.
20 is a donation, yes. The government on their own needs to procure adequate testing kits, and then that will be matched by donations. So I commend the people who are donating, but the government need to spend more. And this shouldn't stop with this. You see, the truth is that our preparedness in terms of our health system was not where we're supposed to be. So after now, we need to spend more. There should not be any reason why a country of this size do not have adequate wraps spread in all the geopolitical areas of this country. So after this period, we need to also do more to strengthen our health system to be better prepared for situations like this.
All right, the one other aspect I'd like for you to touch on, which has to do with the use of personal protective equipment. We were speaking with someone yesterday on the same program, and he talked about the fact that it is important to also create awareness with regards to medical waste disposal at this time. Talk to us. How critical is that? Because he said if that is not taken care of, we might be facing another pandemic with regards to that.
So yes, it's very important. Waste disposal, appropriate waste disposal is one of the principles of infection prevention and control. So it's important, especially not for the teaching hospitals and but for our PHCs, because we might have cases that had not been confirmed, who then go to these primary health care centers. Some of them might die, some of them might recover, but in the process, they might have used PPEs that are not properly disposed. They might have produced secretions that were not properly disposed. And if these are not properly disposed and they then begin to circulate within the community, then we might have widespread infections. And we might not know about it now, but after 14 days, when these cases begin to manifest, then we begin to. So it's important that we manage our hospital waste at this moment. And one way to do that is by educating our health force. The PHC workers, general hospital workers, teaching hospital workers, have they been adequately trained on infection prevention and control? That should be mandatory at this moment for all health workers. The WHO have free online courses on this, and I think that that is important, because if we do not get it right, we might be managing this, but after we come out of it, we then face more crises or more problems in the future.
Now, let's go back to the issue of the use of gloves, face masks, and the likes. Some persons do not really understand the proper use of the gloves and the face mask. Some say that you wear the gloves one per day. Others say the masks, you wear it a certain way, and also about the disposal. You know, by way of education, talk to us how best to make use of the gloves and the masks at this point.
So I'll start with the gloves. So the gloves is like a covering for your hand, and it does not prevent the virus from dropping on the gloves. So it's important that gloves are not used for a long time. So you can use a glove to say, okay, I want to pick up something, I want to clean something. At the end of the day, you dispose the glove. And it's important how you remove it. So you pick it from the tip and remove it, so that you do not then contaminate your hand after removing the glove. So gloves are not to be used for a full day. It's used, a glove is used for a particular procedure. And now if people have to wear it, say for example, to clean a surface, well, this is not something you wear gloves and you go around. It's not appropriate. I must say it as a medical doctor. What is appropriate is wash your hand and sanitize after a while, right? Now, on the use of nose masks, I want to clarify, WHO says it should be worn only in the hospital and for those who are infected, right? But I want to add that some countries have gone beyond that to ensure that all their citizens who are walking around during a lockdown wear their gloves, their face masks. And I'll tell you why. This is because this virus people can infect others when they are asymptomatic. And two, we do not know everybody who is infected at this moment, because we've talked about the low testing, we've talked about a lot of people who were even confirmed, but they say, oh, they were asymptomatic, and up till now, they are still asymptomatic. So I think it's important that nose masks should be worn when you are going out. That is, I know that WHO says only when you're ill, but if we are not sure, or you're going to a place where people are likely going to cough, and also you're likely going to you yourself, you do not know, maybe you feel a little feverish and all that cough, it's important you wear your nose mask, because what it does is it prevents the droplets from spreading to the environment. This disease is not airborne, so it's not about protecting you from breathing in the virus but it prevents you when you cough or sneeze, you do not spread the droplets. Peradventure, you have this virus. Yes.
All right, Dr. Obinna, thank you for speaking with us. Well, joining me via Skype from Abuja is a public health and health promotion specialist, Dr. Obinna Ebirim. Good morning. Thank you for joining us on TVC Breakfast.
Good morning.
All right, let's look at the president's statement, and he asking for a lockdown in some states, Abuja, Lagos, and Ogun. And last Monday, the wife of the president, that's Aisha Buhari, had said that a national lockdown will be preferable, that because some parents will still get in touch with their children, even though there is a closure of schools. And so it may not be as effective as we might see it. But looking at the measure being taken by the president, so to speak, is this in itself satisfactory? Is it enough?
So I would say that it is a good step in the right direction. You know, it's very difficult for a total lockdown, because you think about essential services, those that were exempted. Can we live in a lockdown without electricity, without the health workers without small retail shops providing when our stocks begin to, our supplies begin to go down? So I think what the president has done is the step in the right direction. What I had expected in addition is to then ask that those who are on these essential duties that will be going around, they should ensure adequate protection. So people who are going around, they should wear their face masks, assuming they have this virus and maybe they've not been confirmed. Then they need to protect, make sure as they're going out, they are not infecting others who are being exempted. And also make sure that before they then get home, they wash their hand properly, and so they do not then bring this back home. But I think that what the president has done is right. It is difficult for a total lockdown, because obviously, how do people then survive when they are home? But I think what we have now is adequate in terms of the lockdown.
And then the other aspect that a lot of persons have raised concerns about is the aspect of social distancing, self-isolation. A lot of persons said that this would not be effective in Nigeria, or this part of the world, because of our lifestyle, so to speak. And so an Afrocentric approach to dealing with this issue is what we need.
So, yes, there are things that are not common with our lifestyle, but this is something that is fatal. As the president said, it's a matter of life and death. So this is not a time for people to think about lifestyle. People need to do what they need to do to protect themselves and their community. It's very, very critical. But I think that what is lacking in all this lockdown and all these preventive measures, it's the awareness in our local communities. Some people do not still understand why they need to stay at home, why the government has place this lockdown. And what we fail to understand sometimes is that people in these remote communities, some of them do not have access even to radio. TV and internet are luxuries. So what we need to do in addition to the lockdown is then begin to sensitize people in the local communities using town criers, using their religious leaders, using their traditional leaders, so they understand these preventive measures and why we have this lockdown. That is when you then begin to see a change in lifestyle to suit what would keep us safe and our communities safe.
All right, Dr. Obinna Ibirim, thank you for speaking with us. Well, joining me via Skype from Abuja is a public health and health promotion specialist, Dr. Obinna Ibirim. Good morning. Thank you for joining us.
Good morning.
All right. Now we have a 2 weeks lockdown across 13 states, and other states have already gone ahead to taking the initiative. We have about 25,000 kits. We have 600 tests rather done, and 7 isolation centers, as well as another 6 approved. How much impact would all of this have in our effort to contain the spread and tackle this pandemic in this 2 week period?
So I think that these are progress made, but we are not where we are supposed to be. As you would know, with a population of 200 million and 134 cases with 6,000 contacts, testing only 600 is inadequate. You can also agree with me that with this number, having only 25,000, out of which 20 are donations that are yet to be validated, it's also inadequate. So I think that, as we have said in previous conversations on air, we need to ramp up the testing and also make sure that these new locations become functional so that people who have suspected cases and also have contact with people who have been confirmed, or people who are coming back from countries that have been known to have a lot of confirmed cases, would get tested, and we will have the actual number of infected cases in Nigeria.
So invariably, are you saying that this 2 week period we would not be able to achieve much with all of this that we have on the ground?
We can achieve much, but we need to do more. So if the government begins to put more money, that some funds have been released, but then these funds need to be made to procure adequate testing, open up all these areas so people have access to testing, make sure that this restriction is well enforced so that those who have these cases are identified and people are no longer transmitting this and spreading it. So I think we can. I'm optimistic, but we need to do more. We are not where we should be. We need to test more people and make this testing available by then starting up these testing centers that have just been approved.
All right, taking a cue from other countries, we see that I think in the UK, the government had an agreement or an arrangement with private hospitals. Do you think that that is something that we can also adopt here to enhance capacity with regards to medical personnel?
Yes, I believe in a situation like this, in such pandemic and outbreak, you need to mobilize all your resources. We know that the public health facilities are inadequate, and where they are not well, they don't have the adequate resources to take care. So at this point, we need to mobilize the private sector. In fact, we need to even mobilize human resources that have retired, as other countries have done. So the way to go is use all your resources to contain this disease as quickly as possible.
Dr. Obinna Ibirim, thank you for speaking with us.